We at Phillip Academy are delighted to help you reclaim your health starting today. How, I hear you ask? We aim to do so by presenting you with bite-sized portions of guidance on the causes of the common ailments of our time and how we can best protect ourselves against such threats. We believe that the best way to treat any disease is by not getting it. We'll provide guidance on keeping your body's disease-free. If you fail to maintain your body in its disease-free state, we will suggest useful steps to encourage the return of your bodies to its premier disease-free state. That is, help you reclaim your health. We will address 9 of the most common chronic illnesses of our time. The first 3 of which we will speak are cancer, Alzheimer's disease/dementia, and cardiovascular disease. I hear you ask, why me? So just a little backdrop into my own professional upbringing. Without boasting, I started my professional life as a high school teacher. At this early stage in my life, the intention was clear. Even if I may not have realized it, I was engaged in the business of helping others, training future generations for their lives ahead. I then moved on to university, where I pursued studies in organic chemistry. At the time, in my own mind, I was going to defeat cancer. I started trying to convert a very popularly used chemotherapeutic agent in the fight against cancer, a compound called DTIC. That particular compound was useful but was very toxic. So in my mind, I was trying to convert it into a less toxic form by moving a nitrogen atom from a imidazole ring and replacing that nitrogen atom with sulfur, converting a imidazole ring to a thiazole ring with the hope that the produced compound would be less toxic and would be as efficacious as its predecessor. I didn't complete the project. I completed the degree, then moved on. I spent 1 year in a PhD program in biochemistry and subsequently got into medical school, where the whole purpose continued, helping people. Currently, as a doctor, I am engaged in trying to help the sick reclaim their health. So by doing this series is an extension of my current profession. I have had many joyful, pleasant experiences, but it hasn't always been that way. In fact, I relate to you a most difficult experience which I encountered early in my training. I was party to a team while I was in training and recognized at the lower level of the group with which I was working then, I was involved in doing the menial task. That is, behaving like a porter, carrying equipment to and fro, whereas my other colleagues were involved in the more complicated aspects of care. On the day in question, I was introduced to a 2-year-old boy who was in congestive cardiac failure. So we had to take this kid from his ward to an area where an investigation on his heart could be conducted. As stated before, I was involved in the menial task, so I was involved in moving the oxygen cylinder from the ward with the patient to the area where the test was to be conducted. Whereas my consultants were involved in ensuring the safety of the child. We took him to the area where the test was to be done. He had the test done, and we returned him to the ward. After he was returned to the ward and settled, I then had to move the oxygen cylinder to the area where it could be safely stored. I did this, but on my return to the ward about 5 minutes later, I was told the child was dead. This was one of the most traumatic experiences I've ever had in my professional career so far. I cannot begin to tell you the sort of effect it had on my person. And even today, I still grapple with the fickleness of life. This, in a strange way, has encouraged me to do more for mankind. And that's where Phillip was born. So it's with this background and experience that Phillip was born with an insatiable appetite to address the 9 most common chronic illnesses of our time, so we can help our fellow men and women reclaim their health. We believe that we are uniquely placed with the appropriate tools to help individuals reclaim their health. We hope to help you through this series of discussions centered on the 9 most common chronic illnesses of our time. These will be a three-segment exercise with a 4th segment composed of women's health, men's health, and the 3rd part is on stem cells. Each of these parts is composed of 4 episodes. So that is, in each area or each disease, it will be presented in a 4-part episode. We hope to help you through this series of discussions centered on 9 most common chronic illnesses of our time. Each disease will be covered through 4 episodes. Each of the 3 diseases we'll try to avoid as much medical speak as possible, providing information in a very easy to understand format. We will discuss the known causes of the disease process, giving you a clear indication of its beginning at the cellular level. We'll also explore how the disease takes control of the individual and the current treatment approaches and, regrettably, their failures. Finally, we'll look at how we can strive to make our bodies free from the specific disease process. Further housekeeping continued would be in segment 2 we discuss diabetes, arthritis, and obesity. In segment 3 we talk about chronic lung diseases, chronic kidney diseases, and bowel disease. And in segment 4 we visit women's health, men's health, and stem cells. Today we talk about cancer, and our aim in this episode is to understand the multifactorial nature of cancer causation, explore the body's own internal mechanisms used in the fight against cancer. We will review the current approaches in the management of cancer. We'll also suggest a need to rethink this approach, and we'll give a reason as to why this approach should be rethought. We look at the top 5 cancer discoveries of 2022, and we try to give an explanation as to why there is hope for what happens or what is due to happen in 2035. We'll also learn from the successes of the vaccine used against cervical cancer. Today, strangely, we talk about cancer as an entity which continues to win both the battle and the war. 35 years ago, while working on my master's degree in organic chemistry, I was actively trying to make DTIC, a drug used in the treatment of some gynecological cancers, less toxic by converting an imidazole ring into a sulfur-containing thiazole ring. I was chosen from the Prairie View A&M University to represent the university at a symposium at the MD Anderson Hospital in Houston, a major cancer center in Texas. I was hoping to get a bird's eye view of the thought processes of the experts at that time in terms of how they address cancer. Believe you me, I was determined to crush cancer. Now, 35 years later, the treatment approach to cancer is still the same. We offer surgery to reduce the cancer load on the patient. We offer chemotherapy for individuals in which the cancer has spread beyond the primary organ. And in those cancers which are sensitive to radiotherapy, we offer radiotherapeutic treatment. Today, 35 years later, cancer continues to win both the battle and the war, but our approach has not changed. It is not as easy as one may think, because cancer has certain qualities which makes it overcome or overtake the host. Cancer cells develop ways of avoiding our immune system. Like I said, the immune system is our body's own internal defense to fight against cancer. But the cancer cell has developed means by which it can overcome the host defenses. One of the things that the cancer cells do, and which is obvious by looking around you, is they ignore signals that tell them to stop dividing and die. Normally, in the cell cycle, the cell grows, multiplies, and then dies. But cancer cells is able to avoid death. Hence, the cancer continues to grow bigger and bigger. Additionally, the cancer cells do not stick together very well, which makes them easy to be transmitted from one area to another area. Hence, the whole idea of metastasis, that's the spread of the cancer. Additionally, the cancer cells go into damaged organs or tissues and is able to spread locally. So with the cancer's ability to spread both locally as well as beyond the primary organ from which it developed. One of the ways in which they're able to do that is by developing their own blood supplies. So cancer develops its own blood supplies, which ensure that it has adequate nourishment and at the same time it's able to spread itself. The process by which the cancer develops its own blood supply is known as angiogenesis. Now what we have is a group of researchers that are now trying to develop chemicals which can block this particular step in the cancer proliferation. That's block the ability for it to form new blood supplies, something we call angiogenesis inhibitors. The hope is that by successful creation of those inhibitors, the cancer cells will shrink and eventually die. Cancer cells, however, are able to make their own enzymes which break down normal cells and tissues as they grow, leading to local invasion and eventually invasive disease. So we have seen where the cancer is able to spread itself locally, so we talk about local invasion, as well as to go beyond the primary organ from which it developed, what we call metastasis. Now, we know that to live we need some oxygen. Cancer doesn't need oxygen for it to survive or for it to spread. In fact, cancer cells depleted of oxygen thrives on low oxygen concentration. Those cancers which thrive on low oxygen concentrations are found to be more dangerous, faster growing, faster spreading, and more difficult to treat. Recent studies tells us that low oxygen conditions increase the levels of a family of protein known as hypoxia-inducible factors. These alter hundreds of genes, including one called NANOG, that instructs cells to become stem cells. That is, stem cells are cells that can develop along any cell line. So by creating or by moving cells from being specialized to a sort of pluripotential cell, it also improves the ability of cancer to overcome the host. The incidence of cancer since 1990 to 2020 has increased by 12%, and it is predicted to rise till 2035. The predicted rate of rise is about 2% per year. So by then, we expect to have about 625 cases of cancer for every 100,000 persons. This must be very frightening, but it goes to show that cancer continues to win both the battle and the war. That is despite our efforts to try to control and get rid of cancer, we see a continuous increase of as much as 12% over 30 years, and still predicted to rise even further at 2% per year for the next 12 years until 2035. I leave this to you to ponder on for a bit. Can you imagine this? Our failure to successfully treat this condition and our inability to explore different approaches renders us as mere sitting ducks awaiting our fate. Despite our failures and the continued demise of cancer sufferers, the approach is still, regrettably, the same. My fellow citizens of planet Earth, we continue to lose both this battle and the war. The results of the past 35 years therefore creates an urgency of now that tells us that if something is not done differently and done in a hurry to redress the failures of the past, we are merely sitting ducks, staring at our inevitable fate. It is here that Phillip Academy rises to the challenge, allowing us to reclaim our health by providing you with bite-sized tools that allows you to approach tomorrow with a greater readiness. So today, we aim to start the rethink process in the approach to this challenge. We aim to provide you with useful nuggets in your approach to being cancer-free. We know that cancer develops in a cell, and with the human body composed of over 300 trillion cells, it means that cancer has over 300 trillion potential sites from which it can rise. I can see that you're deep in thought, wondering what causes a cell to turn rogue and develop into a cancer cell. As you ponder that question, I take you through an entity we call the cell cycle. In the cell cycle, made simple, the cell is supposed to grow, divide, and then die. That's the normal cycle of cells. Cancer cells, however, they grow, they divide, but they don't die. So you have an increased mass, an increased volume of cancer tissue. And that is one of the ways in which cancer overtakes the individual. So now that you have pondered what we have just said, one of the questions I'm sure that arises is, how is cancer able to win the battle and the war for so long? Once a cell becomes rogue and develops into cancer, the cancer seeks to overrun the cell processes. By pushing up against adjacent cells, it can secure its nutrition and its other needs in the early stages. Once it starts to develop, it creates its own blood supply through a process called angiogenesis. Through this process, the cancer cell ensures that it has its own nourishment. Every cell has a cycle. The cell grows, multiplies, and eventually dies under normal circumstances. The cancer cell interrupts this process and avoids death. So it multiplies, it grows, but do not die. The cancer therefore becomes bigger and bigger. A cancer cell, like every normal cell, uses glucose as a source of energy. A normal cell uses a certain amount of glucose, but the cancer cell uses 200 times as much. So you can tell that eventually all the available glucose will be drawn towards the cancer cell, thus starving the rest of the cells of the body from their nourishment and a source of energy. So how do we cope with that sort of scenario? Our bodies have its own built-in defense system against abnormal growth. Abnormal growth leads to tumor development. Tumors can either be benign or malignant. It is the malignant tumors that we call cancers, and that's the focus of our podcast. As indicated in the cell cycle, cells divide and form new cells, and in the process need to replace their contents, so that each new cell receives components similar to the parent cell. This does not always happen according to plan, and these bits of material required to ensure that the new cell resembles the parent cell doesn't always happen. And sometimes these bits of substances break up, bits are lost, or sometimes they rejoin but at different locations. That eventually leads to the formation of what we call oncogenes, which essentially are the cancer-producing genes. Under normal circumstances, the cell is equipped with DNA repair genes and tumor suppressor genes, which, as the name indicates, functions in the repair of damaged DNA, and the tumor suppressor genes functions in the suppression of tumor development. And as we said before, it doesn't always happen accordingly. Unfortunately, these natural mechanisms are occasionally bypassed and a tumor develops. This tumor occasionally becomes malignant, which is the focus of the podcast today. To secure its nourishment, the cancer cell utilizes the cell's machinery to develop its own blood supply. The cancer cell also needs glucose for energy, thus there is an increase in the cell's uptake of glucose. The cancer cell uses as many as 200 times more glucose than a non-cancerous cell. With this improved blood supply and glucose for energy, the cancer cell can replicate itself reasonably rapidly. The body, however, has a built-in defense mechanism which fights to ensure that all cancerous cells are destroyed. Occasionally, this defense system is breached and a cancer cell survives and proliferates. Now, after all this, is there a take-home message that you could give us to carry home with us, so to speak? The answer is yes. When we go through this episode, you realize that one of the things that came across quite strongly was cancer arises from an individual cell. Initially, the cancer cell gets its nourishment from adjoining cells. Eventually, the cancer cell uses the cell's machinery to develop its own blood supply. Through this, the cancer cell becomes self-sufficient, having its own blood supply to provide its nourishment and glucose, while simultaneously it makes use of its blood supply as a portal through which it can propagate itself, that is, spread to distant areas. Oxygen is not an absolute necessity for cancer cells. Cancer cells are able to function in the absence of oxygen. These cells in the absence of oxygen are more aggressive, spread more readily, and are more resistant to treatment. Additionally, in this environment, they can develop stem cell-like qualities. That is the ability to develop into any type of cell. With these qualities, it is easy to see how cancer is winning both the battle and the war. So in conclusion, we'll review what we discussed in this segment. In this segment, we have given you an overview of cancer. We have told you that it can develop in any of 300 trillion cells over our bodies. We have also indicated to you that it is the result of a genetic change, something we call a mutation. It has developed a mechanism by which it quickly becomes self-sufficient. And cancer cells are able to depart from the normal cell cycle by continuously growing whilst escaping death. And finally, cancer cells do not need oxygen to survive. And in the absence of oxygen, the cancer is more aggressive. I thank you.